Sawadika. Good afternoon, ladies and gentlemen. Thanks to join today's online seminar. So I'm Nina, the Director of Overseas Medical Mission Center of Changhua Christian Hospital. Same as yesterday, I'm also the moderator of today's session. So first of all, I would like to thank all of our participants. I know many of you joined yesterday's seminar, and thank you again to join today's seminar. The other one that I would like to special thanks our 4 speakers to join us. Before we start today's session, same as yesterday, I would like to invite one of our organizers, Mental Industry Research and Development Center, the manager, Jeff, to say a few words. Jeff, please.
Okay. Good afternoon, everyone. I'm Jeff from Mental Industry Research and Development Center. It is my honor to be here to attend online business matching for innovative smart solution for healthcare. Held by Changhua Christian Hospital. Thanks Dr. Gao and Changhua Christian Hospital for inviting and supporting. I would like to express sincere appreciation on behalf of Industry Development Bureau, Ministry of Economic Affairs and Mental Industry Research and Development Center. The wish this is business matching is successful. And thank you very much.
Thank you, Jeff. And yesterday, our session is focused on innovative smart solution for healthcare. And today, we will share smart medical devices applied on healthcare and management to fighting the COVID-19 pandemic. We also have 4 speakers today. So let me remind each of speaker, you have 10 minutes, only 10 minutes to deliver your presentation. The Q&A session is after all speakers finish their talks. So all speakers, please control your time. And for our audience, if you have any questions, please leave your question at the Slido. The Slido link is at chat box. I will ask my staff to post the Slido link again. And so you can leave your question at the Slido, then we will collect all of the question to ask our speaker later on. Well, I think during the pandemic, maybe many of people like you and me have the sleeping problem because too anxious. Yeah. So our first speaker is Zhening Wang, the Vice President of Somic Company. And he is going to present an innovative device to make you sleep well. So, Mr. Wang, the floor is yours.
Thank you. Good afternoon, everyone. My name is Zhening Wang, Vice President of Somnics. Today, I would like to introduce the innovative therapy for people with obstructive sleep apnea, iNAP sleep therapy system. About Somnics. Somnics is a medical device company we founded in 2010. We focus on developing an innovative treatment solution for sleep apnea, and iNAP is the only negative pressure therapy for OSA in the world. And what is obstructive sleep apnea, OSA? Sleep apnea is a sleep disorder that could lead to serious health problem. People with OSA may stop breathing many times during sleep. And the cause of OSA is soft tissue, for example, tongue or palate, black part of all of your upper airway when you sleep. As a result, OSA patient may not get a good sleep, and those patients will feel tired and often sleepy all day. And why is it so important to treat obstructive sleep apnea? OSA is associated with higher risk of many chronic diseases, for example, hypertension, coronary arterial disease, heart failure, depression, uncontrolled diabetes, and stroke. Untreated OSA will also greatly increase the risk of accident due to the severe daytime sleepiness. OSA is big and growing market. According to the research of 2019, more than 900 million individuals from age 30 to 69 may have mild to severe OSA. However, most of OSA patients are undiagnosed. Therefore, those patients may be suffering in OSA but without realizing it. And this market is also growing rapidly. We all know obstructive sleep apnea is a major public health problem. The government and insurance companies, they all willing to pay a lot to decrease the health risk for OSA patients. Currently, continuous positive airway pressure, CPAP, is the first line therapy for patients with OSA. When using CPAP, patients wear a facial or nasal mask during sleep. The mask will connect to the blower, which will providing a positive airflow into a nasal passage to keep the airway open. CPAP is a very effective treatment. You could always increase the delivery pressure of CPAP until the airway open and sleep apnea disappear. However, only when patients truly use the CPAP, they will really get the benefit from CPAP. Unfortunately, many CPAP users cannot tolerate the false pressure, high flow, headgear, and the facial mask. Half of the CPAP users may quit their CPAP 1 year later after initial CPAP treatment. So how iNAP works? The iNAP sleep therapy is indicated for home use in the treatment of obstructive sleep apnea. Instead of a no-need facial mask and forcing pressure, with iNAP, patient will only need to wear a soft, flexible oral interface in the mouth. By using iNAP, the iNAP system will create a pressure gradient within the oral cavity. This gentle vacuum will pull the tongue and soft palate forward, and then iNAP could stabilize the tongue and free the airway. This slide shows the cephalometric image of iNAP treatment. The left one is the image without iNAP treatment, and the right one is the image with iNAP treatment. You can find the narrow distance of the upper airway will increase from 4.8 millimeter to 5.9 millimeter during the iNAP treatment. It showed iNAP could increase the space of the upper airway significantly. And this year, a pivotal study conducted by Dr. John Morning in Tsinghua Hospital was published in the Journal of Sleep Medicine. In this clinical study, there are 34 patients was enrolled and 32 patients were evaluable. And in the result of this study, we could find the average apnea to hypopnea index will significantly improve from 32 to 8, and minimal SpO2 of the whole night was significantly increased from 80 to 88. And the treatment response rate of total subject is up to 75%. iNAP is incredibly light, small, and compact. It fits in one hand, and it therefore is very travel friendly. iNAP allows you to breathe naturally when you sleep, and iNAP works without mask, belt, and hose. And iNAP is powered by chargeable battery. All those make iNAP become the most comfortable and convenient therapy. And then the patient will sleep well wherever they are. The target users of iNAP, including the patient who cannot tolerate the CPAP, the treatment-naive and sensitive OSA patient, especially for female and children. And for those CPAP users, they can also use CPAP when they are in travel or holiday. We believe iNAP is the best and the first choice for CPAP rejector compared to the dental device and surgery. CPAP rejector could try iNAP without any risk or burden. iNAP is easy to evaluate the efficacy within 1 night, no side effect, and the overall effectiveness were similar to the CPAP. Since 2018, we launched iNAP. We have received a lot of awards. Here's the list of awards we received in Taiwan and worldwide. The safety and effectiveness of iNAP is also approved and accepted by many countries. The marketing approval of iNAP including the 510K, CE mark, and Taiwan FDA, and there are more certificates is underway. We believe iNAP could meet the needs of CPAP users. iNAP allows the user to breathe through their nose naturally. iNAP works without having wear facial mask, belt, and large hose. And iNAP console is silent when negative pressure is reached. iNAP is battery powered and ultra-portable for any situation, and iNAP is a soft and flexible oral interface. So we hope scientists hope iNAP could enable obstructive sleep apnea patients to enjoy their natural breathing anytime, anywhere. So iNAP is the only intraoral negative pressure technology in the world. For more information about iNAP, please visit our website, www.science.com. Thank you.
Thank you very much. Thank you, Mr. Wang. So I think this is a good news for some of the people. If you have a sleeping problem, maybe you can get a small iNAP, then can solve your problem. Okay, let's go into our second speaker. The second speaker is Ian. Ian is the sales and marketing supervisor of New Kimpo Group. His talk is the application of AI robots in smart healthcare. Ian, the floor is yours.
Good afternoon, ladies and gentlemen. My name is Ian Sun of New Era AI Robotics, and today I would like to share with you the application for AI robots in smart healthcare. So the New Era is a subsidiary company of the New Kimpo Group, known as NKG, and NKG has been providing ODM and electronic manufacturing service since 1973. Today, NKG has 24 factories with over 50,000 employees worldwide. Our group is also known as Calcom Electronics in Thailand, with over 30 years of establishment. And it is managing under Chairman Raksu and also CEO Andrew Chen. So we are also named a top 100 global innovator in 2021 out of 14,000 other great organizations in the world. We have been manufacturing for many international reputable brand names, which you will probably use every day, so that you don't know actually know it's being made by NKG. So, New Era AI Robotics focuses on design and manufacture artificial intelligent robots for over 7 years. Our core technology, including autonomous navigation, voice interaction, computer vision, and wearable ECG, to be implemented on products including integrated service robot, smart delivery robot, and smart clothing. Our engineer capability delivers product solution and design to satisfy most of the market requirements. I'd like to highlight some of the benefits for using AI robots in healthcare, because a robot will consistently providing services with quality and efficiency, and that means productivity and safety. Here are the lineups of our robot solutions for smart healthcare, including the autonomous navigation service robots, the AI kiosk, the autonomous mobile robot known as the AMR, and other solution as an expansion based on the AMR. So for service solution, the design of a greeting robot is also with the 27-inch touchscreen kiosk would be a great assistant to share the workload of healthcare workers or nurses. Patients can use our service robot or kiosk to register for doctor, to inquire for information or direction. Robot can also provide bedside self-caring instruction to the patient, or to integrate with thermal camera and hand sanitizer for epidemic control purpose. For this infection solution, because our smart delivery robot is approved by European standard EN 60601 as a medical electrical equipment and capable of carrying up to 100 kg of weight on the top. So it is safe to use in hospital and able to customize with any upper cabinet design, depends on the requirement. In this case, we integrate the AMR with UVC module or the spring module and turn it into a fully autonomous disinfection robot, which can provide service day and night. Now, UVC's robot uses 4 US-made UVC emitters, which is certified by CE, UL, and CSA, and giving a total 440 watts output. It can build maps of any indoor environment and navigate to location remotely, and it only takes 10 minutes to reach 99.9% germicidal efficiency for a room size of 25 meters squared. The built-in rechargeable batteries allows the robot to walk continuously for 3 hours and return to charging automatically. The spring robot uses 4 high-pressure nozzles to spray the disinfectant in mist, covering handrails, public sitting area, or floors for disinfection purpose. The robot also comes with autonomous navigation, with obstacle avoidance and building rechargeable battery for continuous use. All the disinfection tasks can be monitored by application, which is also developed by our company. The maximum spraying coverage is about 3.2 meter width and takes about 30 minutes to sterilize a space of 330 meters square. Our UVC robot is also being tested by SGS for germicidal efficiency, and it is proven that it only takes 45 seconds from a meter away from the subject to reach a 99% disinfection rate for Pseudomonas aeruginosa, which is a common fung pathogen in hospitals. Here are some of the examples where our robots are deployed, not only in hospital, but also in hotel, factory, and so like in retail stores, shopping centers. I also like to share a case study here, which is Taichung Veteran General Hospital in Taiwan. They have over 100 operations a day, and as many of you know, each operation requires a sterilized surgical pack, which normally contains all the surgical equipment needed for the operation, and the pack weighs about 15 to 20 kg. So 100 operations a day, that means a lot of moving and time consuming for the nurses. But with the introduction of our AMR, the delivery robot, all the nurses they not only save the time, but less occupational hazard and higher productivity. Thank you. That'll be all for my presentation today.
Thank you very much. This is a very powerful robot. And our next speaker is Frank Zhong, Associate Marketing Director of GenReach Biotechnology Company. And he's going to talk decentralization of SARS-CoV-2 testing. Frank, please.
Okay, good afternoon, everyone. And first, I would like to thank for the organizer and the invitation from Changhua Christian Hospital. And this is Frank from GenReach Marketing Department. And today, I would like to share our experience in the decentralization of SARS-CoV-2 testing, because GenReach is a company based on PCR testing. So first of all, I would like to share, and this is the overview of the SARS-CoV-2 at this moment. This is in the end of the August. So right now it's over 200 million cases around the world and over 4 million deaths due to the COVID-19 infection. So the mortality rate right now is around 2.1%, and it is a global infectious disease. So everybody are very suffering for this disease, and would like to find a solution for this. And you can see the case report bi-weekly. There are different waves from 2020. So at this moment, from our forecast, that we are not really optimistically to this disease, and we think that we still need to find a solution and ways to block the transmission for this disease. That is why we are here to talking about the concept of decentralization testing. Because in the past, before the COVID-19 outbreak, everybody thinking about the molecular testing are only be available in the diagnostic lab, in the medical center, and also in the reference lab. But from our experience after COVID-19 outbreak, we know that we can implement the COVID-19 testing in the regional hospital, in general hospital, in community hospital, and eventually we also be able to implement our system in the rural public health center. And this make the diagnostic can be done locally and This is why we are thinking about when you have a diagnostics capability in your local area. You don't need to send out your sample to the big hospital or the medical center, so you can save your time. Maybe 1 day or 2 days to wait for the result, and you can do the treatment right after you got the test result in your own clinic or your own hospital. But we know that the reason why we don't really implement the PCR testing before is that we have some limitations when we want to do the decentralized PCR testing. So here we give 3 levels of the diagnostic center. The first is a level 1, is a national laboratory, like our CDC or the MOH in each country. And the level 2 is the medical center, which can conduct most of the molecular tests before and right now. And level 3 is the topic that we want to discuss today, is a community hospital, or we call a regional hospital. This level covers most of the hospitals, but we lack of the capability for diagnosis. That's why in this level, we only have the health professionals, but maybe we don't have the molecular biologists here to do the test. So we need a very low to moderate complexity system to run the test, to allow the health professional to run the test. And the system must be easy and possible to maintenance. And DreamReach is the company to provide this kind of system, and we provide a total solution for decentralized SARS-CoV-2 testing from sampling to PCR. We have our own inactivation medium, which can allow the people to take the sample and inactivate the virus right away on-site. And we also have our PCR system we call the Pocket Central Nucleic Acid Analyzer, coupled with our reagent to fight against SARS-CoV-2. And this is a sample to result system. So the technician only needs to put in the sample, and the machine will do the rest of the things in 85 minutes. So here I would like to share the video here. So you can see we just have a couple of the reagents and the cartridges that provided by the DreamReach. And it's easy for the people to add in a sample in this cartridge. Then you can turn on your machine and wait for the self-test. So the machine will do the self-test each time, so you don't need to worry about the maintenance. And you just follow the procedure and the instruction on the monitor. And then finally, you just put your cartridge into this machine. So you count down to 85 minutes and you got the result. So it's very simple for people, and most of our customers can use this system to run the COVID-19 test in Taiwan and around the world. So we just summarized the procedure. The first, you need to set up your reagent, and you just load your sample here, only 200 microliters, and place the cartridges and type in all the information needed for the test, and you can get the result in 85 minutes with a positive and negative here. So here is some experience and some examples from our customers. In the left side, this is doctors on the remote island. So he is right now using our system to do the surveillance or to do the test on the island for the soldiers or for their officers. And in the middle, this is a nurse on the cruise ship. They implement this system on the cruise, so they can have the routine monitoring to the cruise and to the passengers who have the clinical side of flu-like symptoms. And the right top here, these pictures is in the caring home. These two ladies are nurses in the caring home, so they conduct the test here and use this system to monitor the residents and the workers in the caring home. And in the right bottom, This is a regional hospital in our remote island. So in these pictures, our technician are showing how to run this system, and right now they use this system to check the samples on the island routinely, so they don't need to send the sample back to Taiwan island, and they can have the prompt response with a quick result. And in the last slide, I would like to share our experience in Taiwan. So in the beginning, you can see in the beginning of 2020, we only have 11 institutions can run COVID-19 tests, and gradually, and right now we have more than 200 institutes can run COVID-19 tests, and DreamReach have 1/3 of the institute that use the system in Taiwan. And you can see here the offshore islands. In this slide, there are 6 institutions in the offshore islands, and the DreamReach have 5 of them to run the tests on the island. So that's why we say that decentralization PCR testing is very important, and the DreamReach can be your friend to run this decentralization PCR testing. So here is a message that I would like to bring to you, that decentralization PCR testing that is very important, and it can enable the people have a proper response with on-site diagnostic results. And the Pocket Central, the system from DreamReach, is ideal for decentralization PCR testing, as you see our experience worldwide. And the DreamReach is a good partner to provide you the total solution from sampling to PCR. Thank you for your time, and I'm welcome if you have any questions.
Thank you very much. Thank you, Frank. Okay, so we are going to our last speaker. Last speaker is Jenny, and she's the marketing specialist at Biotech. She is going to talk anti-COVID-19 solution, wireless screen and O-ring. Jenny, the floor is yours, please.
Okay, good afternoon, everyone, and I'm delighted to be here. I'm Jenny Lin from AC Biotech Company, and on behalf of our company, today I would like to introduce 2 anti-COVID-19 solutions to you, and which we already sell very well in global market and help to conquer the pandemic. So the first product is wireless screen thermal scanner, and the other product is O-ring dispenser. So of course, in addition to anti-COVID-19 solutions, we also use our AI technology and software integration to do a lot of smart medical solutions like smart medical information system, uniform or ECG patch, or even we provide an AI system or platform. And of course, our core technology is terahertz, which is for medical diagnosis. So led by our president, Steve, our company was established in 2000, and we do the IoT and wireless communication before. But since 2014, we developed a smart medical solutions like terahertz smart medical or anti-COVID-19 solutions. So basically, our company have our own GMP factory, ISO, and for the 2 products, all of the products are made in Taiwan and made by our GMP factory with our own patents and licenses. So until now, we already built a very good relationship with lots of hospitals in universities or even the schools in Taiwan. Especially, we signed lots of memorandum of understanding with Taiwan's hospitals, as you can see in lots of places in Taiwan. And our Taiwanese headquarters, we have 2 sales bases in China, Suzhou and Shenzhen. But our research institute and factories in Taiwan for these 2 products. And these 2 products already sells in global market like the USA, Hawaii, or even Japan. And India is in progress, or even South Asia in Vietnam. So the first product is wireless screen. This is AI rapid temperature screening system, which combine the visible and infrared image output to deliver a fast, accurate, and stable system. With only 0.5 seconds, we can detect 10 to 30 people at the same time. And the machine can be continuous monitoring for 24 hours. So where there's abnormal temperature, we can have the audio alarm. screenshot and video recording for the users to trace back. So it is very convenient and effective and accurate. And for accurate distance is from 1 meter to 5 meters. So the resolution and accuracy can be still very high. And this machine is contactless and portable and based on the route adjustment. So this is the dynamic detection video. As you can see, we can detect multiple person, at least 10 person at the same time. And it is spontaneous reading. There's no responding time compared with some products. You need to waiting in front of this machine and waiting for the responding time and even concern about accuracy. But our products can do a dynamic detection and help to evacuate people and help the people to maintain the social distance. So in addition to the temperature screening, we can also have the MAC screening function. And while people bring some hot thing in front of this machine, there's no false alarm because of hot things. So at this moment, in Taiwan's hospitals, we build a very good relationship and do lots of integration successful cases for lots of hospitals. For instance, in Taiwan, we combine the patient insurance card to trace TOCC travel or medical histories, and even we can save the data, and even we can do the remote control by the web server platform. So until now, for Taiwan's different industry like the factories, technology companies, research institute, we do lots of facial recognition, which the accuracy can be up to 99%. And combined with access control to provide all-in-one system. While people go into this building, we can detect the employee's ID, name, or even the temperature and the time at the same time. So this is the all-in-one system for users. We can help them to lower the cost and save the time and lower any workloading for the staffs. Even we can do the web server platform at their own computer. So where there are some factors while someone is wearing the mask, or even this machine is put outdoors, or even someone is wearing a helmet, there's no any impact on the accuracy or even the facial recognition. So this is a very large milestone, and we receive our government recognition, especially we won a very large procurement and beat more than 50 competitors in Taiwan who make the thermal scanner, and we implant this machine into at least 50 detention centers in Taiwan. So for the global cases, as you can see, we do a lot of successful integration like facial recognition or access control or barcode in USA, Nashville, Music City, or even Florida in USA, or even the gym in Japan. So also for the USA, we do lots of different customized projects. For instance, we join a non-government organization event to provide products for them, or even do the projects for universities. And even we do a special design for our Hawaii partner, especially our interface is very easy to understand. As you can see, while the different screen mode we can change it. Under the full screen mode, we can detect at least 10 to 30 people at the same time, even more than 30 people based on our AI technology. So the above is the first product. The other products I would like to introduce is the O-ring dispenser. Of course, in the market, there are lots of different dispensers in the market. But some of the traditional dispensers, as you can see, some might easily fall down or even have recessions. But we use the infrared sensor to provide a precise spraying. And when the children's face gets close, it won't sense because we have the smart detection. So just put a pong in this area, we can provide a precise spraying by 4 nozzles. And with the impact buffer, it will keep the stand mode while the children push it. So it is very safe for children or any users. So regarding the power, it is especially convenient. Just only you need to use 2 9-volt alkaline batteries, and it can support 25,000 spraying times. In addition, we can have the auto sleep and start mode and light indication to indicate the voltage and liquid level. So for the users, you don't need to find any power base to plug on, and it is very low power consumption. So of course, in addition to hospitals, we already install in lots of different consumer channels like shopping mall, hotel, dormitory, exhibition hall, or even banks. For global market or South Asia, we especially receive a high reputation from our distributors or users, like the fashion shop, restaurant, office building, or exhibition hall centers. So generally speaking, these two products are contactless. We provide all-in-one system, which is made in Taiwan and with high accuracy, and we are very flexible, can combine with the existing system for the users. For instance, we can do a lot of access control or facial recognition to integrate the system together for the users. And we provide a very best sophistication of the hardware and our AI software. And even for the technical support or marketing support, we can provide the best service for our global partners. So these two products, as I said, these two products contactless and touchless, not only for the pandemic, but also after this period. These two products can support the reopening. After all, for temperature detection and hand cleansing, it is an essential procedure for when people get into large institutions. So
1 minute.
Okay, especially until now, we joined a lot of international activity, like for instance, last year, International Marathon, there were more than 5,000 contestants, and even recently vaccination activities. We already support at least 10 vaccination activities, which held by our government institutions. So basically, these two products can be implanted in lots of hospitals and also lots of different large institutions, as I mentioned. And two products have FCC and CE certificate. So we can directly be used in various channels. And until now, we are seeking a lot of distributors in addition to the partner we already cooperate with. So the above is the product introduction of these two products, and we are seeking more B2B partners for us. So if you are interested in our products, just contact with me by my email or even my WhatsApp. And don't forget to follow us on our social website based on our QR code. So it's truly my honor to be here, and thank you so much.
Okay, thank you, Jenny. So thank you to all of our speakers' presentation. Before we start our QA, can I ask our speakers and our participants, guests, to open your camera? We can take group photo. So everyone can turn on, open your camera. Okay, good, very good. So we look at the camera and smile. Now I say 1, 2, 3. One more. 1, 2, 3. Very nice. Thank you so much. Well, then we are going to start our QA. So once again, if you have any question, please leave your question at chat box or the chat box Slido. So my staff will post the Slido link again on our chat box. And if you join our meeting and join our seminar on YouTube, so the on YouTube, we also description some of the Slido link. So you also can join the Slido and ask your question. So I have the question from our audience to Ian. The question is, are all AI, the all AI robots are equipped with rechargeable battery? Is it right? And how long it can support on a full charge battery? Ian.
Generally, for example, for service robot, because it has many other peripherals like the thermal printers, monitors, like that. For service robot, when the robot is fully charged, it can run about 6 to 8 hours. For our delivery robot, the M01, when it is fully charged, it can run 10 to 12 hours. For our UVC robot, generally it can operate continuously like 3 hours. Similar cases for the spring robot, it can run about 5 to 6 hours. Depends on the usage. Yes, all our robots come with rechargeable batteries.
Okay, so what is the strength of the new era AI robot?
Yeah, and also because we'll provide you the SDK and also the API, so you can program your robot in the way you like it. You can set the robot to return to charge station when the battery level is about 10% or 15%. It's all about your choice.
Good. Okay. And the other question is on Rich. The question is, to use Pocket Central for testing, what is the minimum requirement for working area? Is it suitable for person without any molecular testing experience or background? Frank?
Okay, thank you for the question. So right now, from our experience in Taiwan, the least requirement for the operation in Taiwan, it should be used by the healthcare professionals. So like the nurse or the technicians or the doctors, they can be the users, even they don't really have the molecular background. And for the environment to run the test, in Taiwan, the institute to run COVID-19 tests should be under BSL2. So they should have some biosafety cabinets. But if they don't have biosafety cabinet, they still need to have some clean areas and to suitable for like the POC testing. So they need to wear the personal protective equipment, and they can do the sampling and to run the PCR. And that's it for the environment requirement and the personal requirement.
Yeah, but I think the PCR screening is still very time consuming. So if suddenly come in on many of cases, and do you have any suggestion?
Okay, so most of people think about PCR is really time consuming, like the 4 to 6 hours, like the old days. But right now, if you run with the gene-rich equipment, then you can get a result in 1.5 hours. So it's really benefit and convenient for the people and in the hospital, because right now for our customer, they may have the 30 to 40 samples per day, so they can run with our equipment. One run, they can run 8 samples, so they just need to run 3 or 4 runs, and they can complete their task. So if they have more samples, they just have 2 units or 3 units, because Pocket Central is quite tiny, not really tiny, but it's just like the personal computer or like the oven. So it don't need a very big area for the installation. So in Taiwan, a big hospital, they might have 5 to 7 units in their diagnostic lab, so they can run more than 200 or 300 tests per day.
Could I know the price, the machine?
The price depends on the area. In Taiwan, you can direct contact me, and I can give the quotation to you. There's no problem.
Yeah. I mean not in Taiwan, for example, in other countries, in average.
Okay, in other countries, because it depends on the distributor, and we don't really set the limit to them, because they have some tax or some different issues there. So if they have any interest about our system, that just contact us, and we will provide our contact there and to discuss the price issue.
Okay, so in just like Thailand or other of country, do we have a distributor?
Okay, GeneRich right now we have distributor in Taiwan, Indonesia, UK, and also in the Middle East. So in Thailand right now we don't have partners there. for IVD. So if you guys have interesting about this system, please don't hesitate to contact me, and we do need a partner there to develop our partnership there in the hospital.
Good, thank you.
Thank you.
Yeah, and Jenny, Mr. Wang, Somic. So I would like to know, is there any criteria for patient to use iNAP therapy? And what is the end user price?
Thank you for the question. And according to our result, our clinical research, we find the best population to use the iNAP is the moderate to severe and the non-obese OSA patient. For moderate to severe means their apnea hypopnea index will be ranged from 15 to 60, and their BMI is below 30. So if your patient meet these criteria, then they will be the best candidate to use the iNAP in the first line as the first line treatment. But if the patient already tried the CPAP and fail, I think that iNAP is still the first and the best choice as the CPAP alternative, because the iNAP has no risk and burden. About the price question, the same. The price would depend on the area and the sales package. So it's best answered by the local distributor. But I could provide a reference to you is in Taiwan, the end user price of the iNAP therapy system is about 1,500. So and the packages were including the 1 year accessory. So we believe this price is compared to the end user price CPAP in Taiwan.
Okay, so do you have the distributor in Thailand?
Yes, we have distributor in Taiwan, and another good news is our certificate, marketing approval of Thailand will be going to approval in this month or next month. So, yeah, so so in Thailand, iNAP could be reachable in Thailand.
Good. So the question for Jenny is, what is the main difference between your product and other products for customers? Jenny, can you answer?
Yeah, okay. I just unmute my microphone, and thank you for giving me this opportunity to join a meeting with you guys. And our products, basically, as I mentioned, of course, in the market there are lots of thermal scanner and the dispenser. But what we designed is for the premium customer and to help them to prevent from a cluster infection. Because comparing with some traditional thermal scanner, for instance, just one person detection, and you need to waiting for responding time, and the accuracy concern will be a very, very important issue especially for hospitals. So generally speaking, we provide all-in-one system. We emphasize on our system stability and accuracy. And of course, the Orange dispenser, we have a different designs. Of course, the other dispenser has their competitive advantages. But we just focus on, we target the larger institution, and we hope our possible distributors can target such customer and have such business link to help us to find such end customer in Thailand.
Yeah, so you also have distributor in Thailand, yeah?
Oh no, until now we only have the distributor in Vietnam, as I said, Vietnam or even Japan and USA. But we think that Thailand is a very large potential market for us. We already have some potential distributor talk to us, but basically we don't make actually a cooperation right now. So we are seeking a further chance for discussion. Yeah.
Yeah. Okay. Ian, your product, you have the distributor, but I think you have branch company in Thailand, is right?
We have offices and factory in Thailand. Yes.
Yeah. So how about the after sales service? You can do that very well.
Actually, our company policy has been renewed since the end of last year. We've been centralized all the engineer back to Taiwan. So right now in Thailand, we're also looking for distributors and a system integrator who we can work with. We are transparent to transfer all the knowledge on the software development and also hardware repairs. So we're looking for a partner to develop the local market.
Okay. Yeah. So can I know the price in Thai?
The retail price, the end user price for our service robot and also the delivery robot is around $40,000 to $50,000.
Okay. Good. So any question from yeah. The other question for Jenny is, what is the capacity of O-ring dispenser? Would it be inconvenience to fill?
You mean the
Okay, I say it again. So what is the capacity of the O-ring dispenser? Would it become inconvenience to fill? Okay.
I got the question. So the container, as you can see in the video and the prototype, just put the head up and you can refill the disinfectant directly. And the container is 900 ml and it's very convenient to refill, and there's no installation effort for that. And I just recap this question. And for our dispenser, we only can compatible with a liquid type alcohol, not gel type. But the alcohol will be convenient for Thailand to purchase in local. Yeah.
Good. Oh, okay. So you can see that our 4 speakers' email is on the chat box. So if you are interested in any of products or any question for the speaker, you can write email to them directly. So thank you very much to join us today's online seminar. Looking forward to see you again. Bye-bye.